So we are still struggling with the idea that we've tested it ad infinitum. We've had so many pilots, it's becoming frustrating. We need to now shift into using this as part of our mainstream technology. The same sort of way that we don't think twice about sending patients for a CAT scan. We know the technology is robust, X-rays, MRIs. Telehealth is just another technology we use. It's an enabler for us to do our clinical work better. And we just need to move away from testing it to sort of saying, well, we know within the confines of what the technology can do, what it's capable of, let's utilize that and get more clinical data coming out of it. And that requires my clinical colleagues to really play a much more active role in using it in patients where they believe they can make a difference by the use of the technology. The payment models we still have stuck with in Australia are really stuck in not even the 20th century. They're 19th century payment models where we pay doctors to do a service and walk away. And the challenge now is that our patients require continuous care. So we need to shift to payment models that pay doctors and healthcare professionals to manage patients on a continuous basis. And that's where technology really shines, because it highlights when care is needed and when it's not needed, so doctors can balance their workload a lot more effectively. But at the moment, they're only paid for when something goes wrong, so therefore they sit back and wait for things to go wrong. The reality is, if we're going to keep people healthy longer, we need to interact with them before things go wrong, and technology allows us to pick up some of those trends very early and respond to them so that the person doesn't have to go to hospital to get treated. They can get treated in their home before they get to the stage where they're so sick they need hospitalisation. From a government perspective, we need to integrate any parts of the health and caring services as they relate to a patient, and recognising that the bulk of people who need care are aged. So aged care and healthcare can't be separate entities. They need to be intertwined, and having a model where anyone who interacts with that patient is all part of a shared team. From industry's perspective, we need to develop applications that recognise that and don't develop separate GP systems, separate specialist systems, separate aged care systems, but develop systems centred around patients. So we always talk about patient-centred care, but patient-centred records are the key to that, in that all that information about a patient is centralised. PCHR was a great first step in that, going towards that. It needs to be developed on from more than just a data repository to a care management tool. But the people who need ongoing care, the fragile, frail, elderly people in our community, need us to take responsibility for not just their data, but for their ongoing care. I think from a government perspective, we need to integrate any parts of the health and caring services as they relate to a patient, and recognising that the bulk of people who need care are aged. So aged care and healthcare can't be separate entities. They need to be intertwined, and having a model where anyone who interacts with that patient is all part of a shared team. From industry's perspective, we need to develop applications that recognise that and don't develop separate GP systems, separate specialist systems, separate aged care systems, but develop systems centred around patients. So we always talk about patient-centred care, but patient-centred records are the key to that, in that all that information about a patient is centralised. PCHR was a great first step in that, going towards that. It needs to be developed on from more than just a data repository to a care management tool. But the people who need ongoing care, the fragile, frail, elderly people in our community, need us to take responsibility for not just their data, but for their ongoing care.
Do you think the recommendations of the Royal Report, which have been out for a few months now, do you think that they're likely to be implemented? And do you think that we're on the right track?
Okay. So I think one of the first things that came out of the Royal Report was the sort of the change in the governance model around the whole thing. So someone like Steve Hamilton, so having a clinician as heading that team changes the focus from it being a technology project to being a clinical project. I think the recommended opt-out is a great first step, because people don't identify themselves as sick until it's too late. So therefore, if they have to opt out of the system, we can start gathering data about them that's useful when they do get sick. So we need to have that information early, not late. The other recommendations around making it more interactive is very important. But we need to shift it away from being a data repository to a care management model. And I'm quite confident people like Steve Hamilton, who's now the chair of NEDA, recognises that, and that'll make a big difference to the model. So the risk is that if we don't get opt-out on January the 1st, that you will have a system which won't be as functional. It's important for clinicians to lobby their patients, the government, the industry to really support the opt-out model, because that enables us to provide a much more effective model of care for our patients. I think we need to really lobby to our patients and to government the value of that. So the system is designed to help them. This fear that we're capturing data for data's sake versus capturing data to help patients and improve their quality of life is something we haven't communicated very well. And then there have been various groups which have focused in on the risks. There's always a risk associated, but the benefits accrued are so much greater than the risks that they far outweigh the risks. And we need to inform our patients about that and take a stance as clinicians saying, well, we'll take responsibility for ensuring that the data is used properly. The government needs to sort of then also put in some controls saying, well, if anyone abuses the data, you don't just get a slap on the wrist. There are real implications for abusing the data. But as healthcare professionals, our first focus is improving quality of life of our patients. And all the healthcare professionals I know, and I'm sure the bulk of all healthcare professionals in Australia, that's what their key focus is. So they're not there to spy on people's cholesterol readings. They're there to help that patient improve their life.